All right. Well, thank you for joining us today. My name is Natalie Nordland. I am a consultant with the New York State Trauma Informed Network and Resource Center, or TINRC. Welcome to our webinar where we'll be providing you an overview of the Trauma Responsive Understanding Self-Assessment Tool for Schools, or the TRUST-S. And during this webinar, I'll be providing an overview of why the TRUST-S was developed and how it can be helpful for your school or district to guide reflection and working towards engaging in trauma-informed practices. And we'll also show you the website where you can register and access the tool. And my colleague, Sydney Brown, is with me today as well, and she'll be monitoring the chat. And please feel free to ask any questions that you may have in the chat, although where we're going to be recording this webinar and making it available to all of you and to others, we're going to wait until the end of the informational presentation to answer any questions you may have that you are welcome to ask in the chat or unmute yourself and ask out loud. So once we begin our Q&A at the end, we'll stop recording and ensure that you feel comfortable unmuting and asking your questions if you'd like to do so. So to first provide an overview of the New York State Trauma Informed Network and Resource Center, or TINRC. This initiative, it was founded in 2018 and is funded by the New York State Office of Mental Health. And it aims to elevate conversations and understanding of trauma, toxic stress, and well-being to support individual, organizational, and community action. And at the New York State Trauma Informed Network and Resource Center, we envision a New York State where all people and their communities can attain wellness and resiliency, and that all systems have the tools to support healing from toxic stress and trauma. And grounded in that vision, the TINRC's mission is to promote learning, growing, and the deepening of knowledge. And to work towards this, the TINRC creates partnerships, builds communities, and furthers the understanding of trauma, trauma-responsive practices, wellness, and well-being. TINRC's work is grounded in the guiding values and principles of trauma-informed practices: safety, trust, responsiveness, empowerment, peer support, and collaboration. And moving from learning into action and application can be very challenging. And we want the TINRC to support individuals and organizations in their understanding and application of trauma-informed and equity-focused practices. The Spectrum of Prevention Framework is a systematic tool that promotes a range of activities for effective prevention. And it's been used nationally in prevention initiatives for traffic safety, violence prevention, injury prevention, nutrition, and fitness. And the spectrum identifies levels of intervention and helps people move beyond the perception that prevention is merely education. And at each level, the most important activities related to prevention objectives are identified. And as these activities are identified, they lead to interrelated actions at other levels of the spectrum. And all levels are complementary and synergistic. When they're used together, they have a greater effect than would be possible from one single activity or initiative. In adapting the main components of the prevention framework for our TINRC work to help support understanding and application of trauma-responsive and equity-focused practices, we feel it's important that organizations and individuals hold that the collective work of the TINRC, events, programming, offerings, is intentional. It's intending to build more trauma-responsive and equity-focused organizations and communities through resources and supports across multiple components. The TINRC events, programming, and offerings are aligned with the main components of the prevention framework, which are elevating stories and the work being done across sectors and regions, supporting organizations and practice change, which aligns with the TRUST-S that we'll be talking about today, curating and maintaining networks and connections, educating community and providers, and strengthening knowledge and skills. And in knowing that the journey to advance trauma-informed and equity-centered practice within organizations and communities takes steadfast commitment to one or all of the main components of the prevention framework, the New York State TINRC provides resources and supports to facilitate and fortify the trauma-informed journey. And we invite individuals or organizations to begin or further their journey with the resources and supports that are outlined in the New York State TINRC Pathways of Engagement. And this slide outlines the pathways of engagement that organizations and individuals can take within the New York State TINRC to support their journey in becoming more trauma responsive and equity focused. And in looking at ways that organizations can support their journey, you'll see that one of those ways is for organizations to utilize the trust, or for schools or districts to utilize the Trust 2.0 and to receive consultation of their results. But before we start talking about these tools, and more specifically the Trust S for this webinar, let's first further talk about why reflecting on and working towards creating trauma-responsive systems and workplace environments is important. So what do we mean when we say trauma-informed and trauma-responsive, and why should workplaces, such as schools and school districts, care about this? Well, let's start with the definition of trauma-informed. Put simply, to be trauma-informed means to understand the role that violence and victimization play in the lives of most people, and to use that understanding to design workplace environments that accommodate the vulnerabilities of trauma survivors. And you'll notice an emphasis here on most, to understand the role that violence and victimization play in the lives of most people. So why am I calling this out, and why does this matter for the Trust S tool that we will be talking about today? Because unfortunately, most of us have endured trauma. Trauma is when we experience very stressful, frightening, or distressing events that are difficult to cope with or out of our control. It can be one incident or an ongoing event that happens over any period of time. And when we say most, we mean it, the majority. Just in the United States alone, 70% of adults have experienced some type of traumatic event at least once in their lives. That translates to 223.4 million people in the United States having experienced some type of traumatic event. And within the public health system, over 90% of clients in the United States have experienced trauma. So if we translate these stats into scenarios that we may come across at work, taking that 70%, if you're in a meeting with 5 people, 3 or 4 of those people have most likely experienced trauma. And in thinking about any trainings or staff meetings that you may attend, if there are 50 people present, 35 of those people have most likely experienced trauma. It's an unfortunate reality that trauma is omnipresent. Some studies go so far to say that we should assume that we've all been impacted by trauma. And I think that's an unfortunately very fair assessment, particularly noting the recent COVID-19 pandemic that we've all endured. And in addition to most, if not all people having experienced trauma, we must also consider the additional impact of work-related stress and how stress can further impact who may or may not have experienced trauma. Workplaces are perfectly designed environments to have stress. There are constant demands and often only a finite amount of time or resources to do them. And it's the perception of stress that hinders our ability, particularly when we've endured trauma, that we might feel a sense of overwhelm, a sense of lack of control to effectively respond. and therefore feel hindered in our ability to progress and move through or cope and overcome what that is deemed stressful. 83% of US workers suffer from work-related stress, with 25% saying that their job is the #1 stressor in their lives. About 1 million Americans miss work each day because of stress. 76% of US workers report that workplace stress affects their personal relationships. Depression-induced absenteeism costs US businesses $51 billion a year, as well as an additional $26 billion in treatment costs. And more than 50% of workers are not engaged at work as a result of stress, leading to a lack of productivity. So we'll see the significance here, and that stress and the management of it is important in the systems that create it, such as workplaces. And with that understanding that most, if not all, people have experienced trauma and the awareness that workplace environments can further cause stress, the Trust 2.0 and the Trust S are tools that can be helpful on an organization or a school or district's journey in moving away from the dominance of individualism and towards promoting a system and workplace environment that is trauma-informed and trauma-responsive. Tools that can help an organization or school or district work on a systems level towards unlocking the potential for genuine empowerment, resiliency, safety, and belonging, and in turn leading to sustainable engagement and enriched employee well-being. Focusing more in on the Trust S is a strengths-based self-assessment tool that provides schools or districts a point-in-time snapshot of where they are in their journey towards becoming trauma-informed. The survey is completed individually and anonymously online by all school staff and leadership who choose to take the survey, and it takes only about 15 minutes to complete. And then after a school or district has decided to close a survey round, they're then able to generate and download an automated report that includes a summary of key findings across all who took the survey. And these findings are scored and organized across the 10 domains of trauma-informed organizations, which will be shown on an upcoming slide. The Trust S is encouraged to be re-administered over time for progress monitoring, such as on an annual basis, to help guide continuous reflection, evaluation of progress, and continued growth. And the Trust was originally developed by Coordinated Care Services Incorporated, or CCSI, in partnership with the Institute of Trauma and Trauma-Informed Care at the University at Buffalo for New York. It was funded by New York State Success, a SAMHSA grant to increase accessibility to all organizations across New York State to be able to assess and receive guidance on moving their practice change forward. It was intentionally designed to be cross-sector with the understanding that the entire system needs to embrace trauma-informed practices. And in recognizing the need for a revised version of the tool that's more consistent with school terminology and culture, CCSI also developed the Trust S for educational institutions. And similar to the Trust for organizations, the Trust S employs SAMHSA's 10 implementation domains of trauma-informed organizations. Those domains being governance and leadership, policy, physical environment, engagement and involvement, cross-sector collaboration, screening, assessment, and treatment, training and workforce development, progress monitoring and quality assurance, financing, and evaluation. And the questions within the survey are aligned with and organized by these 10 domains, and the survey report that is produced provides aggregated results across these 10 domains, along with domain-specific actionable recommendations as well as links to resources. And within your automatically generated report, you're able to see a summary of findings across the 10 domains. Here's a screenshot of part of the domain summary page of an example Trust S report. Overall results are given to help paint the picture of where your school or district is on your trauma-informed journey, including areas of strength, emerging strengths, and growth areas, and how this may differ in perception between staff and administration. And you're additionally able to see the percent of don't know responses within each domain across the survey respondents. And percentages of 20% or higher are shaded in orange, as you see here, to highlight a domain, which can help to further reflect on why that might be. So for example, you might find that the policy domain is an area of strength, but there are 40% of don't know responses. So that would be really important and beneficial to reflect on and explore why might this be. And you might find after further reflection something regarding limited communication and limited shared understanding of policies across staff and administration. And beyond seeing an overview of results by each of the 10 domains, you're additionally able to take a deeper dive within each domain to look at the summary of responses for each question within each domain, which might further highlight specific strengths and areas for improvement to help guide action planning. Additionally, recommendations that your school or district can use to strengthen your trauma-sensitive practices, as well as links to resources for each domain, are additionally provided to help guide reflection and action planning. And through the TINRC, the Trust S is available at no cost to all New York State schools and districts. And in addition to the direct link to the Trust site that we'll be providing you later on, the link to the Trust website can also be found on the TINRC website under the Initiatives tab. And we'll put that in the chat. And you're now able to register your school or district on the new Trust website that just launched on Monday. And I do want to note that if you previously had an account before Monday for your school or district on the Trust website, you will need to re-register on this new site, but you'll still have access to any old reports. And New York State schools or districts are also able to request a free 1-hour virtual consultation session with a TINRC consultant after taking the Trust S to help further understand results from your Trust S report and utilizing findings to take next steps. And this consultation session can be requested once you've logged into your Trust account. And since the initial launch of the Trust and Trust S, over 350 New York State organizations and educational institutions have utilized these tools, many deploying the survey multiple times for progress monitoring. The Trust and Trust S have been utilized across various organization or educational institution sizes, locales, sectors. They've been utilized by healthcare provider networks, state agencies, county system of care, community-based organizations, county health departments, schools, school districts of various sizes, and also behavioral health organizations and more. So to provide an example of how one organization in New York has utilized the Trust tool for organizations over the years. YWCA is a nonprofit organization that's been steadily working on transforming practices and culture to ensure everything that they do is in the framework of trauma responsiveness and equity. And they've utilized the Trust over the years to continually evaluate and reflect on areas of growth, areas of opportunity, and utilizing the results to help guide their strategic planning. And as indicated here by YWCA's VP of Strategic Partnerships, culture transformation is hard to measure outside of typical metrics like program outcomes, staff retention, and satisfaction. And we were thrilled when CCSI developed the trust survey because it was a resource that we could use free of charge and benefit from consulting services and community partners to help us drive strategy for the future. So as Carrie highlighted here, the trust can help measure a snapshot of where an organization is on their journey and continued transformation. And beyond typical metrics such as those mentioned, both the trust and the trustess can further allow to hear all staff voices and perspectives anonymously, and specifically evaluate staff and leadership perspectives related to trauma-informed practices within and across an organization, or in your case, within and across the school or district. And now, without further ado, let's explore the website. And the website can be found at trust-survey.com, which we will be putting in the chat. And I am going to stop sharing and reshare to show you the website. All right, so once you arrive to the site, you're going to be first asked to select the location of your organization or educational institution. So let's select New York. And click go. And once you are into the site, you'll be able to learn more or refer back to information about the trustess, and a reminder and definitions of the 10 domains. And you'll be able to access resources, including technical guidance videos, report interpretation guidance videos, an implementation support guide, information about requesting consultation, and also resources on the TINRC website to further guide your work and support your work going forward. You'll also be able to look at answers to different frequently asked questions. You can also, through the website, contact the trust team with any questions or inquiries that you may have. And you'll also be able to log in or register. And just like a reminder, like noted here, if you registered on the previous version of the website, you'll have to re-register here. And it shows you the link to the old version in case you have past reports you want to still access. And once you log in, or you've registered and you log in, as an organization administrator, so that might be you or it might be someone else, you'll be able to create one or more programs for your organization. So for example, maybe you just want one program created where all of your staff and leadership across your school or district are part of the same survey round, and you just want one report based on their collective results across the entire school or district. Or maybe you want to have separate survey round reports, such as different reports based on different schools within a district, for example. So in that case, you could create multiple programs to ensure that those different schools receive different unique survey links to generate separate reports for each school. And this is where you would add the program, which might be, for example, different schools. And in addition, while you have one organization administrator, you can also I go to home. You can also assign a program administrator for one or more programs you've created. So for example, if one primary person is the organization administrator for a district, they may decide to create separate programs for each school across the district and assign a leader from each of those schools as a program administrator for each school, which within the trust website would be considered or called a program. So you'd be able to add their information there and assign to one or more programs. And once you've created one or more programs for your school or district, you're able to then generate a unique survey link for each program survey round to send out to staff and leadership. I'll show you what that looks like. We look at a survey round here, and we go to share. So this would be that survey round's unique link for generating that report. And you're also provided with an example email that you can copy and modify as you would like. And after you've had the survey round open for your designated survey window, and you've collected responses from school staff and leadership, and note that you can also see the number of completed survey responses here, you're then able to generate, view, and download your survey report. So if we go to, here's an example, Trust Us reports. If we go to view survey results, you're going to be able to see everything right here in the browser, like in your dashboard. But alternatively, you can click to download the PDF report. I'll do it so you can see. All right. So this is an example survey round report for the Trust Us. And you will first see an overview of all the demographic information of survey respondents, so those who took the survey, which might be really helpful to know in terms of how representative it is of your actual school or district. And then you're able to additionally see an overview. So similar to what you saw in the screenshot in the one slide, an overview across all 10 domains, across your entire school or district, the areas for growth, emerging strengths, and how these perceptions might differ between staff and administration. And then you're further able to dive into each of those 10 domains, to each question within those domains, and see how people responded, which can further give you additional insight to reflect on. And there are also domain-specific recommendations and links to resources. And additionally, I don't know if it's included in this. It's not in this report because for this one, there weren't any written responses provided. But if any staff or administration provided additional thoughts or comments or questions for the last survey question within the survey, which they're not required to do, but they can, that's an additional page within the survey if anybody did, so that you can further reflect on those additional open-ended responses as well, beyond these other results. But thank you so much for joining today and to learn more about the Trust S. I hope this informational session was helpful in learning more about how the Trust S can help your school or district on your journey in becoming trauma informed. We'll now stop the recording and answer any questions that you may have in the chat or that you might prefer to ask out loud. And we also welcome you to reach out afterwards via the contact form on the Trust website or by emailing my colleague Denise Quamina with any questions you might have.